So for the question, how can CDSS help prevent medication error in this case? So CDSS can really help because it acts like a safety net. When the doctor orders a new drug, the system immediately checks the patient's record and sees the allergy. Instead of waiting for someone to notice later on, it gives an alert right away. This prevents the nurse or doctor from accidentally giving a medication that could cause a serious reaction. It also saves time because the team doesn't have to manually search through the chart. In short, CDSS makes sure the right drug is given to the right patient. And it reduces human error by reminding the staff of important details that might be overlooked during a busy hospital work.
Okay, so as for question 2 of what type of CDSS feature may appear, there are many features that may appear in this situation to help prevent medication errors and also protect the patient from an allergic reaction. And some of which include allergy alert. So this can give an immediate alert or warning, where the system may generate an immediate alert when the ordered medication matches the patient's documented drug allergy. And so this alert will warn the clinician that administering the medication can cause an adverse or allergic reaction. And so this can be displayed as a pop-up warning during the medication ordering process so that the provider can then reconsider or change the order. As well as another one includes drug interaction check. So with the CDSS, it can check whether the new medication interacts negatively with the patient's current medication. And since in this case the patient does have hypertension and diabetes, it is most likely that they are already taking several drugs. And so the system can help compare these medications using drug databases and then warn the clinician if a harmful interaction is detected. Another one includes medication safety check, where the CDSS performs additional medication safety checks. This can help to verify the correct dose, the correct drug, and also the correct frequency, and detect also if the prescribed medication is inappropriate for the patient's condition or age or medical history of the patient. And then reminders to review patient data is also another reminder with the CDSS, and these reminders can be to review important patient information such as allergy records, lab results, or previous medication reactions before confirming the order, and then as well as critiques and warnings. So these can be automated evaluations of the clinician's orders, and the warnings will help to identify any potential risk and also encourage safer clinical decisions. So all of these features, all of the CDSS features work together then to provide real-time decision support, helping healthcare providers detect potential problems early and also reduce medication errors. So thereby it helps to improve overall patient safety.
What is the role of the nurse when the system gives an alert? Our example scenario is a 65-year-old patient with hypertension and diabetes is admitted to the hospital and the physician ordered new medication. The record showed the patient has an allergy, drug allergy. We are the safety net of the hospital actually, as we always double check. Whenever we see alerts, we have to clarify or see the person in person talaga to find or assess and put our medical skills up to it. Tapos we have to see the computer misses something or the doctor is in a rush. We have to advocate our patient and tell what is happening or we have seen. Tapos we are the ones that filter out and focuses what actually matters for the patient's life. This means we are the ones that double checks and clarifies, also tell the physician if there are any medical errors, or in this case a mistake.
Should the clinician always follow CDSS recommendation? Why or why not? No, the clinician should not always follow CDSS or the clinical decision support system recommendation, while there are a lot of reasons why the clinician should not always rely on the CDSS. First, CDSS is only a support tool. It provides suggestion based on the available data, but it cannot replace the clinical judgment and experience of the healthcare provider. Second, patient's condition may be unique because some patients may have special situation like allergies, complication, and other illnesses that the system may not fully consider or may not fully support. Third, we have data errors can occur all the time. If the information entered in the system is incorrect or incomplete, the CDSS recommendation may be also inaccurate.